Welcome. My name's Donna Rolle. I'm a lactation consultant and I work at Stafford Hospital. And I would like to just go over a lot of breastfeeding information for you. We're trying to get that online so you can actually get a peek at it in case you're not able to come to a class. So the first thing I'd like to go over is, why do you want to breastfeed? What's important about breastfeeding? So there are many benefits to breastfeeding. The baby itself is going to be able to have all the nutrients that they need. Mamas usually make more milk than their babies ever need. You've got all the nutrients in there. You've got prebiotics, you've got probiotics, a lot of immunity. And so when you are exposed to things in the environment, your body produces antibodies and it goes right through to the breast milk. So it's like the baby's first vaccine. They have found through studies that the risk of babies getting obesity, diabetes, allergies, ear infections, all of those things are actually lowered when you're breastfeeding. So there's so many benefits for the baby, and the American Academy of Pediatrics actually recommends that you breastfeed exclusively for 6 months and then continue to breastfeed for the next year while you're introducing other foods. Okay, so your body's able to do that. And that's one of the hardest things here in America. We like to see what goes inside a baby so we know what's coming, baby's getting enough. But breastfeeding, you're not going to see that, especially the first couple days. So it's a little more challenging. So what are some of the health benefits for mom? Moms are going to, after their babies are born, the breastfeeding actually helps them to heal faster. It helps that uterus to cramp and contract so that she doesn't bleed heavily. It also has been known through some studies that it can lower her chance of getting breast cancer, uterine cancer, lowers her risk of diabetes, hypertension, a lot of these things that the longer you breastfeed for, the more lower the risk is for that. So, and then of course the benefits between the mom and the baby. You've got this bonding time that it cannot be explained. It's something that you'll find as you go through your breastfeeding experience. But dads like to know this a lot. It's free. There's no expense. So that's definitely a benefit. We've got the milk is always there. It's ready. It's the right temperature. You don't have to do dishes. You get to just kind of feed the baby whenever. And it's definitely less sink time. So one thing, if you take nothing away from this, I want you to remember, there's no perfect way to breastfeed. Okay, I'm going to go over some things that are helpful and we've seen are really kind of techniques that might help, but there's no perfect way. So it's really important for you to understand that and try to relax. There's so many things out on the internet that make you feel like you have to be perfect. Well, you don't have to be perfect, and you're going to learn. This is a learning behavior. Your body's naturally going to produce the milk, but to get the baby there and for you to feel comfortable is really important to just relax. So some of the things that can get you off to a good start are skin to skin, rooming in, and feeding on demand. Okay, so let's talk about skin to skin. Skin to skin after the baby is born and you have your baby right up on your chest so that there is no blankets between you, no shirt. The baby can have a diaper on, but once the baby's up there on your chest, they are actually kind of acclimating to the world. So remember, they've come from this, quiet, dark, very tight little area to this bright lights and people talking and people touching them, and it's very stressful for them. So as you put them up on your body, they actually kind of just get those natural reflexes that they have, and they are able to search for the breast. It's actually been known, babies, we've seen videos where actually babies can crawl right after they're born, within an hour or so, but they can crawl from the belly all the way up to the breast find the breast and latch on all by themselves. So that should help reassure you that it's not going to be all on you, okay? When you have the baby skin to skin, you're going to have a blanket over top of both of you, and your body actually will heat up, and if the baby's cool. If the baby's warm, your body will actually cool down. So it's a way to regulate their temperature. Sometimes babies have problems with their blood sugar at the beginning. This actually helps to regulate their blood sugar. So it's definitely one of the benefits there. And then for you, it really helps to get those breastfeeding hormones going. So it's really, moms really seem to enjoy that time. So then rooming in is actually when you have your baby in the room with you as much time as possible. Sometimes our babies have to go out of the room for a test, or if the baby were having a circumcision or something. But in general, the baby is going to be there in the room with you. And so what's the benefit of that? We have moms who but I want the baby to go in there to sleep so I can sleep at night. Well, your baby's going to be feeding every 2 to 3 hours, so it's important for you to be able to do that. But also you'll hear those little subtle feeding cues that we'll go over in a little bit. You'll be able to really respond to your baby as soon as they're needing something, and it's helping them to learn to trust you and to be more comfortable in this world. So certainly the baby gets to the breast a lot sooner, and that will help to bring your milk in sooner. And then the feeding on demand. So this is not like a spoiling process. You're not spoiling your baby. Your baby has very few needs at the beginning, but one of them is being able to feed, have contact, and those things are through breastfeeding. So there's no set times for breastfeeding. You really can't schedule in the first couple weeks with breastfeeding when to say, okay, every 3 hours, I'm going to feed the baby, so it's 9, so at 12, I'm going to feed the baby. It's not going to be like that, okay? Your baby will sometimes want a snack. Sometimes your baby's going to want a full course meal. So just like us, okay? So you want to get the baby when they have those early feeding cues to the breast. That's going to be the best opportunity for you to get the baby to the breast well without having too much fighting, like the baby gets too fussy, okay? But you're going to be feeding it at different times throughout the day. Just respond to the baby. When the baby looks hungry, you put the baby to the breast. This will help to bring that milk in a lot sooner. And actually, it's okay for mom to demand too. So if when that milk starts coming in, you're going to be really full, and the baby might be too sleepy. So you're actually going to be able to wake the baby at that point just to kind of help you too. So feeding on demand is another one. So what I'd like you to do is see this slide, and it is going to show you some feeding cues. And these feeding cues are early feeding cues. So crying is actually a late feeding cue. That's not, you want to try to get the baby before that. But you can see on this, you can see the first picture, baby sucking on the thumb, and the baby's got the mouth open. So when they open their mouth like that, or they're kind of smacking their lips, or even sucking, they might suck their lip or stick their tongue out. Those kinds of things are early feeding cues. Okay, so they're waking up. They might even just be kind of squirming a little bit. That's when you want to get them to the breast. That's when it's going to be easiest for you. When they get to that crying, it's really hard. You're going to have to settle them down before you can get them really on the breast well. So some of the basics with the frequency, duration. So the first hour after birth is called the golden hour. And in that time is when we want you to get that baby skin to skin. As long as mom is healthy, baby's healthy, then this is what we do at Stafford Hospital. We get the baby there, and within that first hour, they really have a good feeding. Babies tend to be really awake and alert, and you'll be amazed. They can lift their head, they just can't guide where it goes. But in that time, you get them to the breast and let them feed as long as they will. You're going to breastfeed every 2 to 3 hours on demand, and you're going to allow the baby to finish breastfeeding on one side before you go to the other side. So you're not going to feel a difference to know, oh, he's done on this side, but you are going to watch the baby. So remember, we're watching the baby. The baby is going to be able to either sleep, stay on the breast and sound asleep, but you can't get them to wake up to feed anymore, or some of them just kind of pull off the breast and just lie there, and that's fine. So take the baby off the breast, you're going to burp them and just rest with them, okay? In the first couple days, the first 3 days are kind of different for babies. And you're going to be amazed to see how awake the baby is after birth, but then how sleepy they are the next 24 hours. That's a challenging time for moms, and that's about the time that you're actually in the hospital. So we don't get to really, you have to kind of trust us a little bit. The baby will wake up, okay? But the first 24 hours are really sleepy. So things that you can do to kind of wake them up is unwrapping them, kind of wiggling their toes around, changing their diaper, and then you're able to try to feed them. Some babies won't feed at every feeding, and that's okay in the first 24 hours. You want to see 8 to 12 attempted feedings with some good ones, okay? If your baby's having any problems with blood sugars or anything like that, we'll be helping you with that too, okay? Day 2, they tend to wake up more and they go to the breast and they feed more, but it's kind of practicing, okay? So your milk's not in yet. You've got that colostrum, which is really important, but the baby is just kind of doing lots of practice feeding, and you get lots of time to practice to bring the baby to the breast too. And then day 3, this is usually the day your milk starts coming in. The baby's going to do these cluster feedings. Typically happens like that second night. And I'll go in and I'll see a mom and they're like, the baby was up all night last night. I know, cluster feeding. And now the baby's asleep and you can't get it to wake up. But that's very typical. The second night is one where the babies typically will cluster feed. They're just feeding one after another, and it just doesn't seem like you get much rest. But that's actually the natural process to get that milk coming in. So then that milk comes in and things get kind of more on a regular pattern, okay? So on this slide, I want you to look at this one. It has tummy size. So this is so important. You're going to look at your baby and think, oh my goodness, they got to have ounces of liquid. Well, they don't. Their tummy is the size of a grape or a big like marble when they're first born. And so there's about a teaspoon that tummy can hold, which is perfect. You make about a teaspoon of colostrum. So that actually coats the stomach and it really helps them. Then by day 3, your milk's starting to come in, you're getting a little more volume, baby's tummy stretches. It only gets to the size of like a cherry tomato though, okay? And then by the end of the week, you're producing a little bit more, about the size of an apricot, which can really hold about 1.5 to 2 ounces. Usually by 10 days, the size of a regular egg, okay? So remember that when you're worried, oh my goodness, my baby's starving, my baby's hungry, no, baby's been at the breast, they get that colostrum and it really fills their tummy. Now they do digest it pretty quickly, so they will go back for more. What about things to eat? Does mom have to eat anything special? No. There's nothing really that mom has to eat, and there's also nothing that she can't eat, okay, in general. So start out with just eating a well-balanced, healthy diet. You do want to drink lots of fluids, but you don't want to overload. You just need to have your urine needs to be like a pale yellow. If it's getting darker, you need to drink more. But a lot of times when you're breastfeeding, you're going to feel really thirsty, so you're going to be drinking more. And definitely get high fiber foods, so that's just going to help you. But there are some things that we want to be cautious about. So alcohol, drinking alcohol, anytime that you have alcohol in your blood, it's in the breast milk. When it's not in the bloodstream, it's not in the breast milk, okay? So people have been known to like time when they, like if the baby's sleeping for 8 hours or something, you can have a glass of wine after that last feeding. It's not going to be in the breast milk the next time baby wakes. Okay. Smoking, you certainly don't want to have any smoke around the baby, but it also can lower your milk supply. So you want to try to stay away from that. Caffeine is another one everybody worries about, and caffeine can lower your milk supply, so you've got to do this in moderation, okay? It can also hype your baby up, so you might not want to do that too, but usually 1 or 2 cups of coffee or the equivalent in a day is fine. Moms that take medication, there are some medications that are more cautious than others. We just want to watch the baby for symptoms of different things. But most medications, we're finding that the babies tolerate fine. It doesn't hurt them. They have no adverse effects. There's actually a book, Dr. Hale, who works at like NIH. They've got a huge database, LacMed, and we can plug in medications there. He's studied breast milk, the molecules, and like all of the how it goes through the breast milk. So we can go in there and plug a medication in and actually see the studies that have been done and how it can affect the baby or affect your breast milk. Let's see. So there are some things that can increase your milk supply. So if you're having concerns about that, I would not do any of this in the very beginning. This is if you are 10 days, a week out, 2 weeks, 3 weeks, and you're worried about babies not gaining weight, you don't have enough milk. These are things that you can do to increase. Certainly breast stimulation. Okay, so the more the baby goes to the breast, the more milk you will make. There are some things in food, so oatmeal, garlic, dill. There's some mother's milk tea out there. None of these are proven to increase supply, but some women it does. Then there's some herbal remedies. Now you don't want to take any of this stuff without talking to your doctor first. It's really important that they know that you're using these. They can mix with other things. But fenugreek is a big one that you'll hear women will use. Blessed thistle, and there's Golacta. So those are some things that can increase it. Well, what can decrease it? Some diseases that moms have can actually affect that supply. Hypothyroidism, PCOS, even obesity can really lower your milk supply. So it's something we will want to know from the beginning, and we'll work with you at trying to make sure that you can meet those goals. So we talked about how nicotine, that can actually lower your supply. Birth control medications, they are hormones. So talk with your doctor because they can actually lower your supply. I'll have moms call me at 6 weeks and they're like, my milk supply just dropped. And I'll talk to them and I'll see, have you started any new medications? Well, yeah, I started taking the birth control. That's usually what happens. So keep that in mind. We talked about some of the dietary things, and the medications, some of the specific medications are big no-nos is the Sudafed or Pseudoephedrine. That you can know it really does decrease the milk supply. Other things, diuretics, antihistamines, they can lower it, but it doesn't with everybody. So definitely be in contact with your lactation consultants, and we will guide you through that. Okay, so that's all I have for this section, and we will go on to the physiology of breastfeeding for the next one.